Dr. Robert Murphy. He is a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
There's more talk about these variants spotted in Wisconsin now. We talked about Indiana the other day, and I read about more about double masking, and I wondered if that might help against this more contagious variant.
Yeah, I mean, it would. You could put 3 masks on. That'll help even more. You could wear an N95 mask, which is very tight-fitting and one of the better masks. Yeah, anything. But even one mask is like 85% protective. So if you can wear 2, wear 2. That's great.
So the worst day the U.S. had of COVID deaths, it's unbelievable to think of that when we think of how much of 2020 we've been in quarantine. But they say summer could be better?
Well, these type of respiratory infections do cycle, and they're worse in the winter because people are inside. They're more confined spaces. You get to the summer, people more are outside. The virus actually doesn't really like the environment that much, and typically these rates will go down. Now, we had a spike at the beginning of the summer, of course, but that did finally go away. But the combination of the summertime, the number of people who've taken the vaccine, and a change in the government and the policies regarding mitigation, all put that all together, and it's likely to really go down in the summer. That's what everybody thinks.
In the big picture, we're all hoping we never have to deal with this again. The WHO has sent people to Wuhan. What are they doing there, and what does that timeline look like?
Well, the WHO was given permission finally by the Chinese government to send an international team in and investigate the epidemic. How did this thing happen? It includes a representative scientist from the United States. So that was really incredible since we're not even part of the WHO anymore. But anyway, they are over there investigating, and hopefully they'll find something out independently and scientifically proven. But Larry, if you think that this is over, that these kind of pandemics are over, that's just not likely to be the case. There's going to be other ones.
Let's check in with some viewer questions. This person says, I know 2 people who tested positive for COVID in September. Their symptoms were mild. They just tested positive again, and their symptoms are worse. I thought someone can't catch COVID twice because they have the antibodies. Could this be the new COVID strain?
Well, there's several concerning things about this case. Number one, you have to look and see how they were diagnosed, what kind of test. Because some of the tests have what we call false positives. And a lot of people who think they have COVID actually don't have COVID. Now, I'm not saying that this person didn't have it twice. The other thing is, there are very well documented, there are several hundred cases reported worldwide of people getting COVID 2 times, that the immunity that they developed after the first time was not strong enough to prevent the second time. And then what this person brings up is, maybe this is a different strain, maybe this is behaving a little differently. Now, it doesn't sound like the people are all that sick, but we just don't know. But you can get it twice.
All right, next question. Should healthy people who have had the second vaccine shot donate plasma? Will antibodies from vaccinated people help with therapeutic treatments?
Yeah, this sounds like a great idea, but it's actually unnecessary, because the 2 companies, Eli Lilly and Regeneron, that are making concentrated antibodies and selling is much more potent than plasma. So you really, we don't need to do the plasma thing anymore.
All right, last question. Last summer I had an allergic reaction, don't know what from. Can I get the COVID vaccine? Is it safe?
Well, this person is at higher risk for having an allergic reaction to the vaccine. So you have a couple choices. One, there appears to be, this is not statistically significant, but it appears there are more reported cases from the Pfizer vaccine. So if you have a choice between Pfizer and Moderna, I would take the Moderna. You could still have a reaction because there are bad allergic reactions to that too. You could wait for the Johnson & Johnson vaccine, which may be approved within the next 2 weeks. It's a very different kind of vaccine. It's a adenovirus vector vaccine, completely different from these mRNA ones. So you could wait for that one. It's only 2 weeks away. You probably can't even get the other ones now unless you're a healthcare worker. So you have a couple of options here, but I wouldn't do anything other than those three options. I would do, if you can get the Moderna now, get it, or wait for the Johnson & Johnson in 2 weeks and see if you can get that, if that's available for you. But whatever, nobody's died from any of these allergic reactions, nobody. So you just have to hang around the vaccine center, wherever you get the vaccine, for 30 minutes, because if you're going to get the reaction, you get it right away.
All right, Dr. Murphy, if you have a question for him, you can post it on our Morning News Facebook page. We'll talk to him again tomorrow at this time. Thanks, Doctor.
Thanks, Doctor.